Hello, everybody. Just to let you know, we're just going to wait a few more minutes before starting this webinar, but I just wanted to already start the meeting. Okay, should we maybe get started? Don't know exactly whether you've done anything there, Chloe, but your image just shifted from being in on the side to being in the slide, which actually looks quite nice as well. So happy for if you want to stay like this, that's fine. But just know that you are on the bottom right of your slides. So if there's any information there, just bear that in mind.
Okay. Yes, I don't know what I did, but on my side, I just see the PowerPoint presentation and nothing else. I hope.
Okay. No, I think it looks really good like this. Okay. So thank you everybody for joining this EUHealthGov webinar. So my name is Charlotte Gojewski. Together with my colleague Mary Guy, we are coordinating the EUHealthGov research network. And as part of this network, we're hosting a range of webinars that present, in various formats, topics on EU health governance, law and policy. And today we are very excited to welcome Dr. Chloé Bérut for a presentation on digital health and the transformation of EU health policy making. So just a brief introduction. So Dr. Chloé Bérut is, or was until I think yesterday you said, Marie Curie postdoctoral researcher at Foscari University of Venice. And your work focuses on digital health in the European Union, and in particular, the ways in which these policies are shaped at the EU level and how they influence the domestic policy making in this sector, so the multi-level sort of dimensions there. And recently, your research has also expanded beyond the field of health and explored the broader questions about how digitalization affects and transforms EU policymaking across different sectors. And yeah, your work has been published in several academic journals in edited volume, including Governance, European Policy Analysis, and West European Politics. And today you are going to be introducing to us the result of your Marie Curie project, which looks at digital health interoperability, and specifically two different case studies Yes, very excited to hear about it. So without any further ado, oh, actually, just before we start, I do want to mention that this session is recorded, so make sure that you are all on mute. There will be a Q&A after the presentation where I'll be able to unmute you as well. And yes, I think the floor is yours. Thank you very much, Chloé.
Okay, so thank you very much for this really good introduction. Oh, no. Okay, so yes, today I'm going to talk about digital health and the transformation of EU health policy making, and as you said, present the results of this 2-year Marie Curie research project. So here's the plan of the presentation. So I'm going to introduce a little bit the research questions, the case studies, say a few words about the method I used to study these case studies, and then I organized the results into 3 main key findings that I will present. So first, let's start with the introduction. So first, I think the first thing that we need to know is that when we talk about digital health today at the EU level, the main activity that the EU is doing in this area is to make sure that health data are able to circulate between member states. And so to ensure what we call their interoperability. So interoperability is really technical term, which refers to the capacity of different computer systems to communicate, that is, to exchange data. And so, yes, the European Union has really been involved in that since several years and with different mechanisms, and we will go back to that. Of course, all of this may seem really technical, like connecting data and so on, but in the end, I think it may be technical, but it's not neutral. Because, for instance, if you want to exchange some electronic health records, then you have to have a kind of agreement on the data that you want to put on this electronic health record, on the format, on their level of structuration, and so on. And all of that is not neutral, because in the end, it influences the use of electronic health record, but also, you know, has professional practices. And in the end, you can have, you know, strong effects, for instance, on health inequalities or, you know, other dynamics. And so I would say that at the beginning of the research project, I was really interested in this question of, you know, when do we have political choice in all of these really technical decisions. And so in the end, there is really this idea that health data really impacts the way healthcare system operate. And I think the European Commission is actually quite aware of that. You know, I found this quote that I liked on their website. It's not there anymore, but in 2022 it was there. And they say really quickly, health data are the blood running through the veins of our healthcare system. So as I said, you know, this political aspect of technical decisions about interoperability is really what I wanted to study at first. But then working on the project, I started to think that maybe this specific power that the EU is getting to decide on the spaces in which data must be able to circulate, I was thinking that maybe it was a kind of new power at the EU level, you know, opening new ways of influencing member states, and coming also maybe with specific decision-making dynamics, differing from what we see usually in sectors which are not so much focused on digitalization. And so I would say that during the project, my research questions somehow evolved, and now what I'm going to present today, it's a research question which is really focused on the way acting on interoperability creates or not new decision-making dynamics at the EU level. And so to answer this research question, I actually used 2 case studies. So the first one is about COVID-19 contract tracing applications. So maybe you remember in 2020, at the very beginning of the COVID-19 pandemic, we didn't have a vaccine or whatever. Everyone was under a lockdown. And so really quickly, member states try to implement solutions to let people move again without, while containing the pandemic. And so in this case, we needed to trace back, infection. So we did that manually at first, but then there was this idea to use our smartphones to do the work with Bluetooth application and so on. And so what was really interesting is that as soon as member states began to work on this digital solution, the discussion was also happening at the EU level. Why? Because there was this idea that we needed to reopen the border, especially for the summer season, and we really needed this system to be able to work while people were crossing the borders. And so very soon there was this idea that member states needed to coordinate and to make sure that their systems developed would be interoperable, so would be able to work together in the end. And so it was really soft coordination, no law, not anything, but the debate again was really a European one. Then I studied the European health data space and the decision-making process around that regulation. So of course the context is a bit different. It's not during a crisis, and it really it's a binding regulation. And so of course the decision-making process is the usual one of what we find at the EU level with the European Commission, the Council of Ministers, and the EU Parliament. So I guess you've already heard a little bit about this European health data space, but basically it makes a lot of different things mandatory, which is really a game changer in digital health, because before that everything was really soft law and voluntary in nature. So in the EHDS you basically have two main components. The first one is about health data for primary care. So here the idea is really that your health data must be able to travel with you within the EU. So me as a French person, for instance, if I fall ill in Germany, the idea is that the German health professional has access to the data of my electronic health record, if possible, in a translated version, to make sure that I receive proper care. So this, of course, requires some kind of harmonization regarding health data. And then the second aspect of the EHDS is more related to what we call the secondary use of health data. It's for scientific research, and here the goal is really to make access to this data easier across the European Union. To study, so again, I'm a political scientist studying public policy. So generally, what we do when we have two case studies like that is really to collect data about the decision-making process, to understand, who were the actors, what were the issues, what were the solutions that were proposed, decided, and so on. And so I use a qualitative approach to study these two cases. So first, a documentary analysis, of policy strategies, laws, anything that you can find in the media, political discourse, and so on. And I complemented this analysis with 24 semi-structured interviews with policy-relevant actors, so within the European Commission, the Council of the EU, public-private interest groups, but also member states representatives. So now I'm going to continue with the results. So remember, the research question is really like, do we witness some decision-making dynamics that are specific to digitization in healthcare at the EU level? And I thought that the first big question about that would be about private actors. So we all know that private actors have a very significant role at the EU level, even if we don't talk about digital issues. They can influence the decision-making process through lobbying strategies, for instance. But when you start to talk about digitalization, you have new types of actors to consider. So for instance, in healthcare, it's not just, pharmaceutical companies or private health insurance and so on, but it's also, for a part, tech giants. And then the question of course, is to know if their influence is maybe a bit different of what we are used to see in terms of private influence on the decision-making process. And it's actually a very hard question to answer. In my case, so I had two very different results and two very different configurations. In the case of soft regulation, which occurred with the contact tracing application during the COVID-19 crisis, what we saw is that this tech giant had tremendous power thanks to the infrastructure they own. So if I go back to 2020, again, there is this idea of having this contact tracing application, but no one really knows which type of system we should implement. So there is a choice basically between centralized system and decentralized system. And this is really about where you put the data. Do they remain on the phone, or are they centralized in a central server? And there is debate between the two options. They all have advantages, but also risk. And in the end, it's really a political choice between the two. And again, the European Commission did not really know what to choose. Member states didn't know what to choose either. At first, France and Germany decided to go with a centralized system. But then Google and Apple altogether decided to say, okay, in our operating system on the smartphones, we decide that only decentralized application will be able to work. So don't put centralized application on our system, it won't work. We only want decentralized application. And of course, since they own like more than 95% of smartphones operating systems, it really constrains the implementation. And so Germany changed its mind and decided to go with decentralized applications. And in the end, the European Commission also followed that choice. And I think everyone in the EU adopted a decentralized system except for France and Hungary for different reasons. But here we can see that in a soft kind of context, tech giant actually had a really significant decision-making power. Of course, for the EHDS, the context is a bit different because, again, here we go with the usual actors of the decision-making process. So we don't see them that much. We know that they did some lobbying mainly through Digital Europe, which is a group which gathers, different digital companies. But it's a bit hard today to say, okay, they influence this part or this part of the regulation. But I think they will have in the end an influence in the implementation of interoperability infrastructure. Why? Because as soon as you want to implement a digital infrastructure, you need servers, you need cables, and so on. And most of the time, tech giants do offer the most competitive digital environment, so you need to rely on them. But it's a bit less visible and it's a bit harder to investigate. And of course, it's something that we need to study also in the coming years. So then the second main key finding, I would say, is about the transformation of decision-making processes and governance mechanism. What I mean by that. So then again, the question was really during this research to identify interoperability choices, to understand how they then affect, politically the infrastructure that is being developed at the EU level. And of course, to do that, you need to understand where are the decisions taken regarding interoperability and how they're taken. And I found it at the time of the research field extremely difficult to gather answers about this question. First, I noticed that standards organizations were not involved in that process. That could have been an option, but the European Commission decided not to rely on this new approach and not to use standards organization. So the process that we see right now is a comitology process, which means that it's really the European Commission who is in charge of implementing acts and who is going to decide on all these standards of interoperability. So of course you have representative of member states intervening in these committees. Sometimes they have to vote, sometimes they just give an opinion, but it remains a process driven by the European Commission. And of course then the question is, what basis is the European European Commission going to use to produce these standards and all this rule and all this infrastructure on interoperability. And here, of course, it's not, I mean, I guess they're not going to start from scratch, and most likely they're going to use all the results that we have regarding EU-funded digital health projects, which if we look at them, we can see that they've been existing for quite a long time. So since the beginning of the year 2000, we had a lot of different projects. As you can see, they are all somehow overlapping or following each other. And so I was thinking that maybe, you know, these all EU-funded projects are like a governance mechanism that allowed the Commission to create all these standards and create all this infrastructure even before the regulation was adopted. And this, of course, this is going to be reused now that the regulation has been adopted, but it makes the tracing backwards where decision and how decisions were taken really, really difficult. And it also allowed the European Commission to develop all of this, despite the fact that, again, it does not have a clear jurisdiction in health. So I think that really projects were used as a form of governance during this period of time. And I think it's, yes, really a new way of creating also public policy at the EU level in the digital realm. So that would be it about governance mechanisms. Now, I was also interested in what I call digital health politics. And here, basically, the question was, well, since we are talking about digital issues, do we witness some changes in the way, you know, people, actors legitimize, for instance, the intervention of the European Union? Are the debates structured, for instance, differently? Do we see political cleavage that we usually don't see when we don't talk about digitalization? And here I have different kind of results that I want to share. So the first one, which was, I think, really striking, was related to the idea of performance by the European Commission. In healthcare, my feeling is that when you want to do anything related to healthcare at the EU level, then very quickly the central question is, okay, but healthcare is under the jurisdiction of member states. It's not a competence of the European Union, so how do you deal with that? And quite surprisingly, regarding the EHDS, it was not so much the question anymore, because everyone seemed to think that, you know, interoperability was such a good idea. It was really convenient, and somehow the legitimacy aspect was not really discussed. But what was really crucial was the capacity of the European Commission to really deliver a system that work and that are really able to connect domestic systems together. And so in this context, the COVID-19 crisis really gave a strong window of opportunity to the European Commission, not so much a political one, which is usually what we see in political science, but more something related to the technical, because it allows the European Commission to develop systems that really proved to be efficient during this period of time. So I talked about the contact tracing applications, and as you may know, health data were in the end exchanged, and so contact tracing apps were actually working across borders in the EU. But we also had the COVID-19 certificate, I don't know if you remember, but which was also a digital technology that really worked during the crisis. And with these two elements, the European Commission was really able to say, okay, look, I can do it. And it was really crucial in giving some kind of legitimacy to the European health data space. I think it would have been really be different without the COVID-19 crisis. So that was a first line of inquiry and of reflection. Then what I could observe was a technologization of the political debate. So I talk about the centralization, decentralization debate for contact tracing apps, but regarding the EHDS, a big debate that developed within the European Parliament maybe was about the opting in and opting out option, and it was about giving the citizen option in the interface or application or whatever, to say, okay, I agree or I disagree for my health data to be used for research. And so I have two points about that. First, I think it can create new inequalities in the debate, because of course, if you want to talk about decentralization, opting in or opting out, then you need to have to master a certain degree of, technological option. You need to be able to talk about this technological option, and I think that somehow it can change, the debate and how actors can engage politically in that debate. And then I also had the feeling that sometimes using a technological option was also a way to maybe simplify a debate, which was actually way more complex than that. For instance, regarding the opt-in, opt-out option, well, it's nice to have a technological option. It's important to say, okay, I want my data to be used or not. But in the end, it's not consent in the legal sense. And it can also be really easily circumvented when you say that you want to use health data, for instance, for public interest. So in the end, it doesn't really fit with the legal and political issues that we have around the issue of consent. And so, yes, it was also a way to circumvent these more difficult issues. And I think it's also a dynamic that is interesting to study. And finally, what we can witness maybe also are new political cleavage on digital issue. So in the case of the European Health Data Space, basically at the European Parliament, it was really consensual, except for the Greens and the far right, which were against the regulation, not for the same reason. But what I found really interesting is that I have a colleague working on digital issues broadly, and he seemed to say that this particular cleavage was really visible regularly as soon as we talk about digital issues. So in this case, health would be another case of this new type of cleavage at the digital era. So just a short conclusion. So of course, I think further research is needed to identify the specificities of the digital transition in policymaking, because it's quite hard to pinpoint, and we are just at the beginning of understanding how digitalization really changes the way we are used to make policy, of course at the EU level, but also at the other levels of government. Another point I think which is particularly interesting is that it shows well that health is a really good case to study broader dynamics in decision making, because as you may know, the European Health Data Space is a pioneer case for all the future European common data spaces, which are currently developed in 13 other policy sectors. So it shows well that studying health can help understand what happens elsewhere, especially that everything that I just presented regarding health, all this project-based governance and so on, are also apparently occurring in other policy sectors. And maybe to conclude in a bit more pragmatic way, so yes, the regulation was adopted officially last year, but we are still waiting about 80 implementing acts in the years to come, and that's where all the technical decisions I was referring to are going to be adopted. So I think it's really important to stay updated and to see how this EHDS is developed. Thank you.
Thank you so much, Chloé. That was fascinating and really, really clear as well. Thank you. I have quite a few questions, but before I ask them, I just want to first ask the audience if anyone wants to raise a point, or if anyone has a question, please raise your hand, and then I can unmute you as well. If not for now, then I'll give... okay, we have one question from Diane. Let me unmute you. I think you can now unmute yourself. I can also allow the camera as well. Diane, are you able to unmute yourself with the button? Hello? Oh, okay. Yeah, of course, no problem. Yes. So while we wait for Diane's question in the chat, maybe I can start with a comment or a question that I had. I mean, I think this is really fascinating, and I wonder if you were able, especially in the section on where you talked about private actors, if you could expand a little bit more on what is at stake when it comes to choosing the centralized versus decentralized options, because I don't really understand or know much about sort of these digital technological issues. And so I just wondered how come the tech giants, how come they pushed for a decentralized approach only. And then I guess so this is sort of a specific question, but then the broader implication or the broader question that I have in mind relates to how does this fit into the bigger priority or the big priority of the EU to generate or to ensure strategic autonomy? I feel like, you know, competitiveness is taken as an issue as a matter of security, that the EU wants to really make sure that it is that this does not depend on other countries, because the dependence and interdependence is seen as a vulnerability. And I wonder how, when it comes to health data, which seems like a very sensitive issue that you don't want, you know, to have in the hands of a potential sort of enemy country, kind of, how does this concern about weaponization of interdependence, did that feature in the discussions about interoperability, and how much does the EU depend actually on other countries for sort of their digitalization agendas? So those were my two questions.
Thank you.
I can
should
also
I answer and then
yes, maybe you answer it first, and then I will read out loud the question from Diane.
Okay, good. Yeah, thank you very much. And so the case of contact tracing applications is really fascinating, and I didn't say much because then the presentation would have been longer. So the issue between centralized and decentralized system. So in centralized system, so basically you see people during the day and your phone record people that you see, and then all the data go in a centralized server, which also gathers people saying, okay, I am sick. And then they do the matching on this centralized server, and then they send a message like, okay, you've been in contact with someone infected or not. The advantage of that is first that for the central authority who is in charge of this, you can have view on the pandemic, on how it develops and so on. So it can be useful for public health purpose, but it's also the fact that health data are not really circulating, because when people say I've been sick, they only say it to the central authority. All right. Of course, the risk with that is that you have a central authority who has access to all the people. Of course, it's pseudonymized, but they call that the social graph. So all the people that you saw during the day, which if you don't have a democratic government, you know, it can be a little bit tricky. When you have a decentralized system, so all the data remain on your phone. So and it's really the phone doing the matching. But to do that, it means that you still have some kind of centralization, because at the end of the day, people infected tell that to the application, then it's all centralized, and then the list of infected people go back to each of the phone, and then it's the phone doing the matching and seeing if you've been in contact with someone. And so the issue is that you actually have health data on everyone's phone. And if you do a little bit of research, then it's really easy for one person to remember and say, okay, let's see who I saw today, and to see that the matching occurred at that time of the day. And then you can trace back who is infected. So it's really not that easy to say, you know, this option is better. So a lot of scientists said that decentralized option is better because you don't have a central authority having access to the social graph, but you still have this issue of having health data a bit everywhere. So again, I think it's really a political choice, and it depends on what you think it's the biggest risk. And so, yes, what happened with Google and Apple? It's really, well, no one really knows why they decided on that. I think one hypothesis is maybe that the App Store are actually available through the world. And so maybe they think that what they develop for European countries, they also develop the same, I don't know, for China or for countries which are not that democratic. And maybe in this context, it was better to go with a decentralized app. This I don't really know because, of course, no one knows. They just decided, you know, one day to publish a document and say, okay, so on our app store is going to be decentralized application. We are going to support that and not to support a centralized application. And because they're on the infrastructure, you know, no one could really say something. Maybe, you know, in another context, we could have decided on a law that would have made them change their mind, but in a crisis context and a self-coordination context, you cannot do that. But I think it really showed really well what it means to have an infrastructural power, because they own the infrastructure, then they can decide on this type of things. And so, of course, there's this whole question of the strategic autonomy, which is related. And so I don't really know how it's going to develop with the European health data space. But again, at a point in time, you need cables, you need servers to store your data. And most of these are still owned by tech giants. So in France, we had this issue. We have very big centralized health database, which are about all the social security data about all the French citizens. So that's really a lot. And to facilitate the access and the processing of this data, the government decided to store a copy. And at first, this copy was on Microsoft servers. And of course, that's an issue because if you do that, then you have the risk that American authority can access this data. And so there was this whole debate in France. And so the government said, yes, but this is the only option that we have. I can see now that it's changing slowly, at least in France. I know that there is this whole project also, you know, at the European level to have a sovereign cloud and so on. But most of the time, you can see that tech giants are still part of the project. So I think things are changing, but in the end, we remain somehow dependent on these tech giants. And since they are most of the time American, there is this issue of American law applying to them. And so, but yes, there was a lot of debate about that. I mean, legal debate on this. So I don't know. I'm a bit optimistic, but I'm not really sure that in the end we're going to get rid of them this quickly. Okay, so yeah, do you want to?
Yeah. No, thank you so much. That was very clear. Thank you very much, Chloé. I can now read out loud the question from Diane Whitehouse. So Diane says, you refer to governance in terms of EU project governance. It's not entirely clear to me who is governing what. In reality, many projects have been involved since around 2004, 2006. And the challenge is often in coordinating their activities, i.e. in multiple consortia.
Yeah. Now, thank you very much for this comment. And I think it really pinpoints to the difficulty I have with these projects, because in the end, there are, yes, multiple, it's kind of a nebula of projects with all people sometimes doing a little bit of the same thing, sometimes it's a little bit different, but in the end, they do produce public policy because they do produce infrastructure, they do produce standards, which are also reused between projects and so on. And so at first I saw them also just like projects, but in the end, if you look at how they developed, you have some projects which are more focused on policy advice, on, for instance, giving advice to the EHDS network for a long time. So I think if you look at them, you can see that for some of them, they really have the function, they help governance mechanisms to function somehow. But I think, of course, the way we think about EU project in the first place, it has nothing to do with governance. But if you look in the end at what these projects do and how they are used, they actually participate in the governance because they produce part of the result of the infrastructure that is going then to be applied for everybody. And I think that specifically the fact that they are not, that the coordination is an issue is also part of the issue, because in the end you don't really know who took the decision and why. And so I don't know if it's a strategy by the European Commission actually, but I think we really need to look further into this kind of project and to really understand how they contribute to the governance, because here I think it shows that, you know, policy is not just crafted within the European Commission and within the European Commission service, but also in these projects. And I think they also contribute to consensus making between member states, because they work, you know, for many years on all this topic. And so, yes, I think they are really worth looking at it. And again, that's part of the difficulty and also the challenge, and also why it's fascinating to look at this project, because it's a bit complicating, a bit messy, but still really crucial, I think, for what happens today in terms of interoperability.
Yes, is that why you termed a new mode of governance as being interoperability as new? It's really interesting. Yeah, it's a sort of new form of soft governance kind of thing.
Yeah. That's a question, of course, but I'm really interested to see that when you look at, for instance, the European data space on mobility and in energy, they are still doing this kind of projects. And they are very different, but you know that in the end, the infrastructure and the standards are going to come from there. So I think we need to look at what happened there, and also what are the political dynamics within that, because they matter in the end. But I see that Diane maybe wants to add something.
Yes, Diane says, thank you. It's an interesting shift from mere consultation in European Commission speak of the first decade of the century, or bigger partnership platforms. Yeah.
No, yeah, it actually took me some time to say, like, but it's not just project. So yeah, let's see what it requires further investigation. But
interesting. Any more questions from the audience? I was also interested in okay, there is another question from Diane. I'm really sorry that I'm not able to unmute you completely. But yeah, I was interested also in what you mentioned, that there was not that much sort of a questioning of the legitimacy aspect of it. And does that mean also that there was no kind of backlash from EU citizens in terms of like privacy, data privacy, and was it sort of accepted as actually like seen as a necessary good? And then related to that question, if you don't mind, would you be able to tell me a little bit more about how you said that the opt-in opt-out is not actually enough to really fundamentally tackle the question of consent? Like, could you elaborate a little bit on that as well? While I see some other people are putting questions in the chat.
Yeah, thank you. So yes, I was also a bit surprised, but I tried to study the narratives around interoperability, and it was really clear that the narrative I got was really, oh, it's so convenient, you don't have to repeat exams and so on. And so I was a bit, yeah, but it's still the EU intervening in an area in which member states usually disagree and so on. So yes, it was really focused on that aspect. And well, I think it may be a bit early for citizens to react, because we don't have yet, you know, the application. We cannot see as citizens the European data space right now. But I think what the European Parliament did to really focus on this idea of opting in, opting out, it was really connected to that, and to the idea that yes, at the end of the day, we want the citizens to have the feeling that they have a choice with what we do with the health data and so on. And I remember that the European Commission was a bit, okay, that's nice, but at the same time, maybe we're going to give the impression that they have a say, while in the end, they don't really have a say regarding how their health data are used. So they were a bit afraid of the backlash linked to this opt-in, opt-out proposition. And so how this opt-in, opt-out proposition relate to consent? So, health data are sensitive data. So basically, if you want to use them based on consent, you need to have consent for one specific study. It's not a broad consent. You need to inform people that they are going to use data and so on. So it's really, I mean, most of the time, no one really uses this legal base to use health data. For instance, the data that I was referring to in France, you cannot just contact people from every citizen and say, okay, we're going to run a study, do you agree? And of course, it also, it has a lot of issues in terms of confidentiality. So most of the time, when you want to use data which are already there, but that you did not collected, you need to use other legal bases. So that would be, I think there is legitimate interest or public interest. And so you need most of the time to show that you're doing something for the public good. And so there is interest for everyone to use this data. And in this case, the citizens cannot really say, I don't want my data to be used, especially for public interest reasons. And so that's why, you know, this opt-in, opt-out question, it's not consent, it's something else. And at the same time, it's not because you put opt-out that your data won't be used. So I'm not really sure it will give the feeling of having a say, but I'm not sure that it's really translated in real life and is a use that is going to be made of their data. But at the same time, again, I think this idea of opting in, opting out, a few years ago, no one really cared about that. But it's really important, the type of option that you chose, because I didn't say, but yes, opting in is when you have to do something digitally to agree on something, and opting out, you have to do something not to benefit from the service and so on. And that's really important. For instance, if you look at electronic health record, you can either choose opt-in, so people have to be proactive to open an electronic health record, or opting out, which means it's open for everybody. If you don't want it, you need to do something. And that gives like a lot of different results when you want to implement your electronic health record. So it's really important to look at these technical options, but the way it has been used, I'm not really sure that, yes, that it really solves the issues that we have in terms of access to data and consent.
Okay, yeah, that's very interesting. Thank you very much for the clarifications. Yes, so Diane also says that it would be interesting to see how the many much more larger scale initiatives like partnerships and platforms will continue to proactively support the actual implementation of the example implementing ACT until 2035 or so, and or the new support centers.
I totally agree. And I think it's really also crucial because I spoke about the projects before, but we still have projects right now that are indeed there to support implementing ACT. And I guess we'll have also projects for the concrete implementation. Maybe you have this new kind of organization, which is what is the name? European Digital Infrastructure Consortium, I think. And so it's a new kind of organization that you can set up at the EU level. And in that, you will have also private actors. So these are still projects that we will have, you know, this role of create and maintain interoperability infrastructure. So of course, this idea of project continues after the regulation. And so I think we really need to take that into account as really a new mode of governance. And that's fascinating because in the end, like the regulation part now is just like a small part of the process. You have all these projects before, during and after, and maybe the regulation, the decision-making process around the regulation is not anymore the crucial parts that we need to look at to understand what happens at the year level. But again, that needs to be developed further.
Thank you very much, Chloe. Any more questions from the audience? Just raise your hands if you want to jump in. Okay, I mean, if not, then yeah, I think we can bring this this webinar to a close. I just want to take the opportunity again to thank you very much, Chloe, for this fascinating and very insightful presentation. And thank you also for the audience for joining us today. I just also want to make you aware that a recording of this event is going to be made available on the UAC's YouTube channel, and as well as a short summary as well will be published. And if you would like to stay in touch with the activities from EUHealthGov network, then you can visit our website, which is euhealthgov.org. And there is the possibility to sign up to a mailing list there. And we are also on LinkedIn as well as EUHealthGov. All right, so I wish you a great rest of the afternoon. And thank you again, everybody.
Thank you.
Thanks.
Thank you.
Bye. Bye-bye. Thank you,
Bye-bye.
Chloe. Thanks, everybody. Bye.